Hi everyone, welcome back to second video of this lecture. So for this video, we're gonna discuss more on the typical antipsychotic agents, or known as first generation antipsychosis. So let's have a recap back what you have learned in the previous video. So the overactivity of the mesolimbic pathway from the ventral tegmental area to the nucleus accumbens will cause the positive symptoms. In contrast, the hypodopaminergic activities from the ventral tegmental area to the cortex, or known as mesocortical pathway dysfunctions, will lead to the negative symptoms as well as the cognitive deficits. So the pharmacotherapy of schizophrenia generally consists of the use of antipsychotic medications. So chlorpromazine was the first antipsychotic medications that synthesized in early 1950. So this drug served as prototype for many other antipsychotic agents, and numerous antipsychotic medication options have become available since then. So the development of chlorpromazine led to the creation of additional first generation, or known as typical antipsychotics. Subsequently, clozapine, which is the second generation, or known as atypical antipsychotic, was discovered in late 1970s and introduced in the market in the 1990s. So it is used in a subset of individuals with psychotic disorder who have not benefited from the conventional antipsychotic medication. So antipsychotic drugs are divided into typical antipsychotic as well as the atypical antipsychotics based on their specific neurotransmitter receptor affinity and activity. So as I mentioned before, typical, or known as first generation antipsychotic drugs. Meanwhile, for atypical, known as second generation antipsychotic drugs. So at the first, these drugs can have two affinity in the serotonin as well as in the dopamine receptors. So chlorpromazine was the first antipsychotic medication synthesized in early 1950s. So this drug served as the prototype for many other antipsychotic agents. So the development of chlorpromazine led to the creation of additional first generation typical antipsychotics. So the major chemical subtypes including the phenothiazine, chlorpromazine, butyrophenones, haloperidol, as well as the thiazidines. So a list of many typical antipsychotic drugs is listed here. So these drugs are usually also known as conventional antipsychotics, but they are sometimes also called as classical antipsychotics or first generation antipsychotics. So the key pharmacological properties of all neuroleptics with antipsychotic properties was their ability to block dopamine D2 receptors. So these typical antipsychotics share the primary pharmacological property of D2 antagonism. So as shown in this icon representing the single pharmacological action. So this action has proven to be responsible not only for the antipsychotic efficacy of this drug, but also for most of their undesirable side effects. So let's discuss in depth on the mechanism of actions of these typical antipsychotics. So we start with the mesolimbic dopamine pathway. So as I mentioned earlier, the pathway begins in the ventral tegmental area and connect to the limbic system via the nucleus accumbens, amygdala, as well as the hippocampus. So in untreated schizophrenia patient, the mesolimbic dopamine pathway is hypothesized to be hyperactive due to a loss of dopamine neurotransmitter in this pathway. So what happened? They will be led to positive symptoms such as delusional as well as hallucinations. So administered of these typical antipsychotics, or known as D2 antagonists, will block this dopamine from binding to the D2 receptors, which reduce the hyperactivity in the pathway. So thereby, they will reduce the positive symptom as well. So there is no doubt that these typical antipsychotic medication exert dramatic therapeutic actions upon positive symptom of schizophrenia by blocking the hyperactive dopamine neurons in the mesolimbic dopamine pathway. However, there are several dopamine pathways, as I mentioned earlier in the first video. So it appears that it not only blocks the dopamine receptors at the mesolimbic pathway, but it also blocking dopamine receptor in the remaining pathway, which will cause harmful to the patients. So how this drug, typical antipsychotics, or known as first generation antipsychosis, worsen the negative and cognitive symptoms. So we will discuss more in depth on the mesocortical dopamine pathway. So in untreated schizophrenia patient, as I mentioned earlier, there is already experienced the hypodopaminergic activity in this pathway. So it's projected from the ventral tegmental area to the dorsolateral prefrontal cortex, which lack of this dopamine neurotransmitter in this brain will cause this patient experience the cognitive deficits, as well as when the hypodopaminergic in this ventromedial prefrontal cortex, which cause the patient experience the negative symptoms. So what actually this drug does, this drug, which is the typical antipsychotics known as D2 receptors, will antagonize all these dopamine receptors in these brain regions. So administered of this drug could further reduce the activity in this pathway, and thus not only not improve the symptom, but actually will potentially worsen the effect. So treating a patient with schizophrenia with these dopamine antagonists can successfully treat their positive symptoms by reducing this dopamine signaling in the mesolimbic pathway. However, unfortunately, in order to block adequate number of D2 receptors in this pathway, it will cause simultaneously block the same number of D2 receptors throughout the brain and cause these undesirable side effects. So these dopamine antagonists also reduce the signaling in this mesocortical pathway, meaning that the negative and cognitive symptoms are not addressed and in some cases can be worsened. When we talk about the nigrostriatal pathway, so it transmits the dopamine from the substantia nigra to the striatum. So this pathway is associated with motor control. So in schizophrenia, the dopamine activity in this area is normal. But when administered of typical antipsychotic, which is the first generation, a substantial number of D2 receptor will be blocked in this nigrostriatal dopamine pathway. Since this nigrostriatal pathway is part of the extrapyramidal nervous system, this motor side effect associated with blocking D2 receptors in this part of the brain are known as extrapyramidal symptoms or EPS. Extrapyramidal symptoms will produce various disorders of movement such as acute dystonia, akathisia, tardive dyskinesia, as well as symptoms that can appear very much like those in Parkinson's disease. So this is why these movements are sometimes called drug-induced Parkinsonism. So let's discuss on the mechanisms that underlying these extrapyramidal syndromes. So the dopaminergic neurons in the nigrostriatal pathway have an inhibitory effect on the muscarinic interneurons that regulate the motor activity in the body. So what actually happens when the patient will be administered by typical antipsychotics or known as D2 antagonists? So this drug will reduce the inhibitory effects of dopamine, resulting in increased firing of cholinergic interneurons that will enhance release of acetylcholine and the development of extrapyramidal symptoms. So this drug also affects the dopamine in the tuberoinfundibular pathway. So the dopamine from the hypothalamus transmit to the pituitary glands, which will secrete certain hormones including the prolactin. So this prolactin release is physiologically regulated by both dopamine receptors inhibitory as well as the serotonin stimulatory effects. So in untreated patients with schizophrenia, the effect of these two regulatory mechanisms are balanced, resulting in normal level of prolactin release. In contrast, when administered of this drug, which is the first generation antipsychotics, will increase the prolactin release by blocking the normal D2 mediator inhibitory mechanism, which reduce the release of prolactin. So this cause the plasma prolactin level will be rise, which a condition called as hyperprolactinemia. This hyperprolactinemia also will lead to the galactorrhea, amenorrhea, as well as the osteoporosis. So hyperprolactinemia is associated with a condition that called galactorrhea. So galactorrhea is a milky discharge in the breast, or known as breast secretions that can occur both in male and female. Besides that, hyperprolactinemia also may cause amenorrhea, which is the irregular or lack of menstrual periods. Hyperprolactinemia also interfere with fertility and might lead to more rapid demineralization of bones, especially in postmenopausal women who are not taking any estrogen replacement therapy. So other possible problems that associated with this elevated prolactin level include the sexual dysfunction and weight gain. To men, it will cause the erectile dysfunction and the ejaculatory dysfunction. So picture here shown an icon representing a conventional antipsychotic drugs such as haloperidol, trifluoperazine, and thiotizine. So these conventional antipsychotic have pharmacological properties in addition to dopamine D2 antagonism. So multiple agents also have the ability to block muscarinic cholinergic receptors, histamine H1 receptor, as well as the alpha-1 adrenergic receptors. So one particularly important pharmacologic action of some conventional antipsychotic is their ability to block muscarinic M1 cholinergic receptors. This can cause undesirable side effects such as dry mouth, blurred visions, constipation, and cognitive blunting. Differing degrees of muscarinic cholinergic blockade may also explain why some conventional antipsychotics have a lesser propensity to produce EPS or extrapyramidal side effects than the others. Other pharmacologic actions are associated with these conventional antipsychotic drugs include the generally undesirable blockade of histamine H1 receptors, which will cause weight gain and drowsiness to the patient. However, not all conventional antipsychotics have the same sedative effects. The blockage of these alpha-1 adrenergic receptors causing cardiovascular side effects such as orthostatic hypotension and also may lead to the drowsiness. As with sedative and antimuscarinic side effects, some typical antipsychotic disorders have more ability to cause cardiovascular side effects compared to the other agents. So bear in mind that typical antipsychotic agents differ in terms of their ability to block these various receptors that represented here. This table indicates the relative receptor binding affinities of antipsychotics. For example, haloperidol has relatively little anticholinergic or antihistaminergic binding activities, whereas the classic conventional antipsychotics, which is the chlorpromazine, has potent anticholinergic and antihistaminergic binding. Because of this, conventional antipsychotics differ somewhat in their side effect profiles, even if they do not differ overall in their therapeutic profiles. Alright, before we having a short break and continue to the next video that we will discuss more in the second generation antipsychotic or known as atypical antipsychotics. So let's have a recap back what you have learned in this video. So these typical antipsychotic drugs are more effective in improving the positive symptoms such as hallucinations, delusions, disorganized behavior, as well as the disorganized speech. However, there is not much effective in terms of the negative symptom and cognitive deficits. So these conventional or typical antipsychotics are characterized by undesirable side effects such as extrapyramidal syndromes or known as EPS, hyperprolactinemia, tardive dyskinesia, and possible neuroleptic malignant syndromes. So these symptoms are specific to the group as a whole and generally associated with high doses. So, however, approximately about one-third of the patients with schizophrenia fail to respond with these typical antipsychotics, and high proportion of these patients are going through to the relapse incidence.